I think that it has been very interesting, the fact that at the beginning, the cardiology involvement in COVID-19 was not identified, even if the data from Wuhan very early, already at the beginning of March, they were already presenting that there was, in their terms, was a myocardial involvement like a myocarditis. What we have come to understand over the years is that many different impacts have occurred in the COVID time to cardiac patients. One important one is that at the beginning it seemed that we had a decrease in myocardial infarctions. But unfortunately, what could have been difficult to explain but interesting and positive aspects turned out to be a real important problem that we are now seeing and facing. That is, that patients were not coming to the hospital when they had chest pain. And these recreated a going back situation where the patients, by not coming very early, immediately after the chest pain started, to be treated and revascularized, what happened is that they developed very severe myocardial infarction, so that now we're seeing patients that have experienced an acute MI in the COVID time and is a very severe one, going back 20 years with the size and the importance of the damage that has occurred to the heart. So this is problem number one, that for several years now we will be seeing and facing these patients with a much more extensive myocardial infarction than what we are seeing now at the time of the novel technologies applied to the disease. The other point that is also very interesting is that despite it is still not clear whether the COVID virus enters in the cardiac cells, or rather it stays in the leukocytes or macrophage, and so is a more response related to the inflammatory component. But what we are seeing is that several patients have, in fact, a cardiac involvement that is expressed and seen as fibrosis in the heart. And so, and this very often is on the side of the right heart that is related to the pulmonary congestion and pulmonary disease. So in a sense, it is practice changing to have been in the COVID time. First, for what I have described about the patients with ischemic heart disease, and second, because of this novel compromisation of the heart that is still not clear in terms of pathophysiology, and therefore what we do not know is how it will evolve over time. Therefore, we are all following patients tightly, and we will see how the development of this COVID myocarditis will be really developing over time. So I think that most of the cardiac centers have now established a COVID clinic.